Hello, my friends. Off we head into the sympathetic nervous system. We just had an overview of the ANS, the autonomic, and now we'll do the sympathetic, the parasympathetic, and the enteric. And that's one, two, three. That's the three parts of the autonomic nervous system. We'll start with the sympathetic, fight or flight, and getting you amped up. And this is what we'll do. Two-part test yourself. Part one, remember, this is thoracolumbar outflow. And these are roughly the 6 places where that outflow comes from, broken all the way from T1 superiorly all the way down to the sacral, S1, S2, S3. Sort of the sacral region around there, give or take. And then there's 8 things on the right hand. Why 8 to match 6? Because a couple of these things come out of, so in other words, if you come over to the left-hand side, one of these areas is going to produce several different things. Okay, so you'll figure it out when we get there. So say T, I'll give you, it's T10 to T11. T10 to T11 is going to have 3 different effects here, but the rest of them will just have one sort of outflow, if you will. Okay, and then we'd go through this, and this will be a test shelf just for you. I will not go through it, but you'd be able to, I'll verbalize them, but by the time we're done, you'll be able to tell what each of these things is going to do under sympathetic innervation. What are each one of these things going to do when you want the body to get amped up? All right, let's get started. Sympathetic, fight or flight or fright. We've been spending forever in the CNS, in the somatic. Now we're just locked into the autonomic. And in this case, we're specifically paying attention to the sympathetic division, right? Fight or flight. And we'll go sensory, integrated motor, and it'll be pretty straightforward. On the sensory side, what do you really need? You do not need your specific somatic sensory information. If you hunt for it, you will not find it. What do you use? You use essentially somatic and special sense information sensory. Okay, that is enough right there to get your autonomic nervous system, to get your heart rate from resting to 200 beats a minute in about 5 seconds, right there. Okay, you do not need specific sympathetic sensory input. You can use somatic and you can use special. Again, hearing brakes screech behind you is enough to get your heart rate through the roof. Smelling smoke is enough to get you. Even your equilibrium senses. How many times have you been wandering around and you stumble and lose your balance and you catch it? First thing you do, of course, is look around and make sure nobody saw, right? Then you realize your heart is suddenly pounding because that feeling of losing your equilibrium, right? So it'll work just fine. Then where do we integrate? Well, you've got your pontine and medullary autonomic centers, remember, for breathing, your pneumotaxic and your apneustic areas, for heart rate, vomiting, coughing, all those happening in the pons and the medulla oblongata. Way down low in the sacral spinal, you've got reflex arcs that cover micturition or urination and defecation. Then your limbic system nuclei, they introduce emotion and memory into the whole concept, right? Fear, rage, euphoria, sadness. But remember that your hypothalamus is really the driving force. And from here, from these anterior hypothalamic, forget about the posterior, they're involved in the other arm, parasympathetic. We'll talk about that next video. But from here, you're getting a lot of input, and then you're driving neurons down, and you're pinging on T1 through, you're pinging on the lateral gray horns of cell bodies in the lateral gray horn, I should say, of the vertebrae T1 through L3, and you're just smashing them, and you're sending out thoracolumbar output generated from the anterior nucleus, hypothalamic nucleus of the hypothalamus. All right, and then on the motor side, here we go, because it's all about motor. Here we go on the motor side. Don't worry about this diagram. It'll make perfect sense before we finish. But up in the hypothalamus, I'll draw it kind of right in around here. It's your hypothalamus for whatever. It's sending upper motor neurons down, and it's just pinging all of these cell bodies, T1 all the way down to L3. And it's just pinging them, and it's sending out motor impulses from here and from this, from the spinal column to the right. You can see all these preganglionic motor neurons, all shown as solid lines. These are the ganglion, either trunk ganglion in a tall row here from superior cervical ganglion all the way down, or a second set of ganglion called prevertebral ganglion. And all these blue ovals are called prevertebral ganglion. So it's either in a sympathetic trunk ganglia in this column, or it's a prevertebral ganglion in this column. It doesn't make any difference. It accomplishes the same thing. Preganglionic in a solid line until you get to the ganglion, and then postganglionic in a dotted line, unmyelinated, away from the ganglion to the effector. And these are all the effectors on the right, and we'll talk about the effect of each one of them under sympathetic innervation. And then don't forget that every single one of these can also go over to the skin. We'll talk about that in just a second. Okay, so and then here's just the rehash. Be sure this is 100% clear. Out of the lateral, and again, remember that I would just love this to be back here just a touch from the lateral gray horn and not so much the anterior. But out it goes through the anterior root, sharing path along with the alpha motor neuron, right? Myelinated, cholinergic to the ganglion. Again, either a sympathetic trunk ganglion or a prevertebral ganglion for the sympathetic system. It doesn't matter which one. Postganglionic, unmyelinated neuron is going to be adrenergic, releasing norepinephrine at either cardiac muscle, smooth muscle, or some sort of gland that's going to amp up your body somehow. Going to get you completely amped. All right. So, 4 ways we have to look at this. And we got to be pretty careful about these 4 ways and make sure we understand them. One is the very straightforward path that I just talked about, and it's pretty straightforward. It's down. All this starts with the anterior hypothalamic nucleus pinging all these new cell bodies. But let's say it pings onto T1 in the cell body. Out goes your motor outflow. It goes to the sympathetic trunk ganglia, and it synapses there. And then your postganglionic neuron comes out and goes right to the effector. That's the simple way. We talked about that. Consider that way number 1 by this circle number 1. Consider that just to be the standard bearer right there. Okay, presympathetic, preganglionic to the ganglion, postganglionic to the effector. Not a problem whatsoever. Really the gold standard. It's the basis off which everything will vary for all intents and purposes. What would number 2 be? Well, coming out, same thing, coming out of the lateral gray horn, but instead of synapsing on the ganglion, in this case the sympathetic trunk ganglion, at your segmental level, you're going to pass right through this one ganglion and then either ascend or descend to another sympathetic trunk ganglion. And that's 2, we're showing it ascending. So T1 is going to come out, ascend all the way up to a higher ganglion, more superior ganglion, the superior cervical, and then synapse there, and then move out on one of these postganglionic neurons towards an effector. And that's important because if you look between, say, C1 and C8 and these superior, middle, and inferior cervical ganglion, they're all on the same level, but look, there's no connection here. No connection whatsoever. So you have to descend to T1 through T5 roughly, and then from T1 to T5, you can then move through and ascend back up to superior and middle and inferior cervical ganglion. All right, so we'll call that route number 2, as evidenced by the number 2 right there. Route number 3, we won't get into detail here. I'll show you in another slide, but you do this little dipsy-do. You come out of the, and this is everything, every single one from T1 to L3 can all do path number 3. It's just shown for T5 right here, but it could happen at every segmental level. You come out and you do a little loop-de-loop through the rami communicantis, and then you loop back through, and then you feed the integumentary system. And you feed the dermatomes of the body, and you feed every single square centimeter of your integumentary system, and you get it moving to help you out. And I'll show you that loop in a little bit of detail in just a couple slides. And finally, number 4, you pass right on through, and instead of synapsing on these trunk ganglia, you pass right on through. I'll pick one here, say T11. You pass right through this ganglia, don't even stop. You come through and you reach a prevertebral ganglion and you synapse there. Okay, and then from that prevertebral ganglion, here's a postganglionic neuron, and that's feeding your effector. So it's just that you pass right through. You don't synapse at the trunk ganglion on your level. You don't synapse at the trunk ganglion on a higher level. You pass right through and you synapse on a prevertebral. What does that make you? It makes all these nerves that are passing through, it makes them something special. They're called splanchnic nerves. Just a term, okay? Just a term you have to learn. So if you're passing through the trunk ganglia on the way to a more lateral prevertebral ganglion, then you are a splanchnic nerve. And let's look at those in a little more detail, and we're going to focus here, same four motor pathways, but now we're going to focus on this sympathetic ganglion in the trunk ganglia right here. Okay, we're going to focus on this one right here. Pathway number 1, you come out of the lateral gray horn through the anterior root, loop around on the white ramic communicans, because that's really the only way you get to the sympathetic ganglion. And pathway number 1, you simply just synapse on some cell body, and then you move out. It's not showing it, but you move out on a spinal nerve, and a postganglionic neuron, and you simply go to some effector, right? And this is the postganglion. I should have shown it dotted, but I don't have time to dot that, but you can figure it out. So preganglionic nerve coming out, goes to the sympathetic ganglion, synapses at the ganglion to a postganglionic nerve, shown with this arrow, and that just hooks up with your effector, in this case, the lungs, right? And it goes to the smooth muscle of the, it goes to the tissue of the lungs, and it has some sympathetic effect. That's the standard one that we use as the reference for everything else. What would number 2 look like in this particular diagram? Okay, you're coming out, and you're coming out the anterior root. You're coming through, but you pass right through the sympathetic ganglion, and you ascend all the way up, and you synapse here on a higher, more superior sympathetic trunk ganglion. Right? And in this case, you move over, and you have a postganglionic nerve, unmyelinated, and that goes to your effector, and you have your effect here. Increase your heart rate, increase your cardiac volume, if you will, at the heart. Those are sympathetic effects. That was 2. What about 3? Well, 3 is this funny loop, all right? You're coming out the anterior root, same thing. You come through on the white ramus communicans, right? Or right ramus communicans, singular. The white ramus communicans. Then you synapse inside the trunk ganglia, and then you head right back on this dotted line, and that's a postganglionic neuron. And that's the gray ramus communicans, right? It's unmyelinated. So the white ramus communicans is myelinated because we know it's it's preganglionic neurons that we know are myelinated. And then it synapses in the sympathetic trunk ganglion, but then heads right back in the gray ramus communicans in the unmyelinated pathway, and it just joins right up, and it just feeds all of the dermatomes. So it jumps on the spinal nerve, and it heads out to all the dermatomes, and it has sympathetic effects at erector pili, at the dermal blood vessels, and at the sudoriferous glands, the sweat glands, and it has effect there that we'll all talk about that. And then finally, number 4 from this diagram, same idea, same start, out of the lateral great horn, which is repeated over and over again, through the anterior root, and out through on the white ramus communicans to the sympathetic, but now right through the sympathetic trunk ganglion. No stopping, no synapsing. Right through it, and automatically be thinking that makes me a splanchnic nerve, because I went right through the sympathetic trunk ganglion. I'm a splanchnic nerve. I go all the way out to a prevertebral ganglion, a little bit more lateral away from the spinal cord, and I synapse there, and then I do the same thing. I have my standard postganglionic neuron that just goes and feeds my standard organ or effector, and I have a sympathetic effect there. Okay? So those are the 4 we want to keep track of. But now we're going to look at the outflow in terms of, where can I put myself? Put myself right here. Now we're going to look at the outflow in terms of moving superior to inferior. Okay? So we know the 4 different paths, and we'll reference them. Like, for instance, this first one I talk about, we'll reference back to path number 2 that I just talked about for the last 5 minutes. That's the one where you ascend. And let's look at what T1 to T5 do. All right? So this is going to be sort of root A. And what's happening, again, anterior hypothalamic nuclei are coming down, and they're pinging T1 through T5, okay? They're hitting the cell bodies at T1, and they're activating the cell bodies, and they're sending motor impulse through T1 through T5, through the spinal nerves, the preganglionic nerves. They go right out. They do not synapse at the trunk ganglia at their segmental level. They go right through, and they ascend. And where do they ascend? They ascend to the, they ascend to the superior, they ascend to the middle, and they ascend to the inferior cervical ganglion, to be plural, okay? Ganglia to be plural. Ganglion singular, ganglia to be plural. They go there, and then they synapse on, and then they fire off their post-ganglionic neurons, or all these dashed lines, okay? So they go through, and they, right through the sympathetic trunk ganglia, ascend up to where they want to go. They hit on the superior, middle, and inferior cervical ganglia, and then they head off. Where do they head off to? Well, they go through plexuses. Don't worry too much about the plexuses. You've got a pulmonary plexus, a cardiac plexus. You've got an esophageal plexus. You've got a carotid plexus kind of feeding all through here. But essentially what they're doing is they're heading to all these effectors in the eyes, all these glands in the face and the neck and throat, the heart and the lungs and the esophagus are the tissues that are being fed, right? So this is where the postganglionic neurons end up at. So we better, and again, I'm just going to verbalize these. I'm not going to draw these all out for the interest of time. I'll just tell you what's happening in each one of them and just write it down and take your own notes, okay? At the eyes, what are we doing at the eyes? What is this loop coming down through T1, possibly up through to the superior cerebral ganglion and these postganglionic neurons feeding the intrinsic muscles of the eye? What are they doing at the intrinsic muscles of the eye? They are dilating them. Ciliaris is opening up your pupil so that you can suck in as much light as possible. And everything I'm going to talk about for the next 10 to 15 minutes is going to be about a bear chasing you through the forest. If you've been chased by a bear through the forest, you know exactly what I'm talking about. If you haven't, this is what will happen. Your eyes, like they say, are like dinner plates. They'll open up as big as possible, trying to get in as much light as possible. And you'll accommodate in such a way, change this lens without you knowing it, to facilitate far vision, so you can see. You don't need to be reading fine text on a can of garbanzo beans, right? You need to have your eyes wide open and picking up as much visual information as you're tearing through the forest. Lacrimal glands don't really need to make tears at this point, so decreased secretion of lacrimal glands. You're running for your life from a bear. Salivary glands, decreased secretion. You don't need to be producing saliva and thinking about eating at this point in time. Esophagus, decreased motility or mobility. You don't need to be processing and swallowing food at this point in time. Heart, the SA nodes are pacemaker. That's rate. Heart rate up through the roof, right? The cardiac muscle, you're going to increase the force of contraction. Those two together are going to increase your heart rate, your blood pressure, all together. That's going to crank up your cardiac volume, right? Cardiac output. And your bronchioles dilate, open up the bronchioles, the tissue of the bronchioles. Open them up so that you can suck air in, all right? And this is what you want in an asthmatic attack, right? In an asthmatic attack, you want to open up those bronchioles. So any kind of chemical that elicits a sympathetic effect is going to be a good candidate for an agonist for an asthmatic medicine. Open up those bronchioles and amp you up so that you may run away from a bear. All right. Also at T1 to T5, you can just do the similar, the step number one. You see T1 through T5, you don't have to ascend. You can just come right to the sympathetic trunk ganglia at your level, synapse, and pick up one of these postganglionic. And look, you go to the same place. You go to the heart. Here's a route through to the heart that I just traced. Here's a second route through to the heart. And the second route I just traced, you just ascend to the superior cervical ganglion. Or you can ascend to the middle cervical ganglion. And look, you go to the same place, right? So nothing really changes there at all, just a different route. Let's move down inferiorly to T5 to T9 now. So now we're moving down to T5 to T9. We're pinging those cell bodies in the lateral gray horn. We're sending motor output, preganglionic neurons. Remember, everything in solid blue is a preganglionic neuron. This time, T5 to T9, we are passing right through the sympathetic trunk ganglia, not stopping. It's path number 4. Go back for a few slides, look at path number 4. You have become a splanchnic nerve. If you're in T5 to T9 and you're coming out of T5 to T9, that part of the thoracolumbar outflow, you are the greater splanchnic nerve. See how they all coalesce here to become the greater splanchnic nerve. And this is sort of pathway B. You go to something called the celiac prevertebral ganglion, not a sympathetic trunk ganglion, a prevertebral ganglion. And it's the celiac. And then follow where the postganglionic unmyelinated neurons go. They go to the liver. They go to the stomach, right? They go to the pancreas. And what are they going to do when they get there? They are going to have effects. What are they going to do at the liver? Again, I'm just verbalizing this, so write this down and take notes. What do they do at the liver? They stimulate glycogenolysis. Glycogen is the polymer. With all your glucose molecule, you don't want it in that form. You want to chop, 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 and release every single one of those little glucose monomers into your bloodstream and get your blood sugar through the roof, right? Get it through the roof and just take off with high blood sugar. Gallbladder and bile duct, they emulsify fat to help you digest fat. You're running for your life from a bear. Your fat digestion doesn't really need to happen. So you decrease secretion at the gallbladder and the biliary tree. Your stomach, Decreased motility and mobility. You don't need to be churning your stomach when you're running for your life. Decreased secretion of digestive enzymes. You don't need to be doing that. Decreased absorption of nutrients. That's all going to come on the parasympathetic arm. So knock it off for now and forget about it. Pancreas, what are you doing? You are increasing the secretion of glucagon. What is glucagon? It is the opposite of insulin. Insulin pulls sugar out of your blood and tucks it away in your cell. Glucagon cranks sugar up in your blood, so you've got huge blood sugar, so you can metabolize and run for your life and continue to run and run and run. All right? Let's move a little bit inferiorly. T10 to T11. These are big ones. You're going to become the lesser splanchnic nerve. Follow from T10 and T11. I come out and I coalesce onto the lesser splanchnic nerve that I just highlighted there. Right? A lot of things can happen from the lesser splanchnic nerve. There's 3 places I can go. Let's talk about the first one. The first one is kind of this circuitous route, and then ending up at the aortico-renal ganglion. And that's this ganglion that I'll outline right now, path C. If you end up at the aortico-renal ganglion, you're going to be, and then follow where it goes. Where do you come out of the aortico? Follow this postganglionic neuron and that postganglionic neuron from this prevertebral ganglion. So this prevertebral ganglion is called the corticorenal, and follow these 2 postganglionic neurons. Where do they go? They go to the kidney, basically. And what's going to happen at the kidney, the renal parenchyma? You're going to decrease urine production. Why would you need to pee when you're running for your life? So you're going to decrease, that's the last thing you want to do. So you're going to decrease urine production to keep it pretty simple. All right, let's move a little bit inferior. I'll go back to T10 and T11 with 2 more pathways in a moment, but I'm continuing to move inferiorly. And now we're going to look at T12. And in T12, what are we doing? We're coming out as the least splanchnic nerve. And we're heading to something called the renal ganglion. So the preganglionic neuron is a splanchnic nerve, and it's going to the renal ganglion. And what's it doing? Same thing, feeding the kidney. Follow the postganglionic neurons. I'll just outline those. Follow the postganglionic neurons, no big deal. They're feeding the kidney and they're shutting down urine production. Same story. All right, let's go back to T10 to T11 because 2 different things can happen. If you kind of follow this convoluted path, you can see that if I come out of T10 and T11, I can route through the lesser splanchnic nerve again, and I can kind of route around in this sort of weird arc, and I can come to this ganglion, the superior mesenteric ganglion. And then there follow this postganglionic neuron, and you can see I'm hitting up the transverse colon, I'm hitting up the small intestine, and I'm hitting up the ascending colon too. All right, and this is a big one. What are you going to do with these places? At the small intestine, decrease motility. You don't need to be producing feces when you're running for your life. Decrease absorption of nutrients and decrease secretion. Okay. At the colon, decrease motility, decrease movement. You do not need to be producing feces and moving fecal matter through the pathway at this point. You want to stop all that, right? Forget about digestion under sympathetic innervation. All right, and then kind of nearly pretty much down to the bottom. Let's go down to L1 to L3. And at L1 to L3, you're going to become, again, same thing, path number 4, letter number F. You're following right through the sympathetic trunk ganglion, no stop. You become a splanchnic nerve. You become the lumbar splanchnic nerve, and you feed this baby right here, the inferior mesenteric ganglion, and then follow the postganglionic neuron. Where's it going? It's going to the colon. Right? The sigmoidal colon and the descending colon. What's it going to do? You know this. And to the rectum too. Decrease mobility. Stop peristalsis. Stop moving fecal matter through. Just let it be for now and run for your life and get away from the bear. And then later on, worry about digestion and producing feces and defecating. Right? And then lastly, it's not meant to be a little facetious, but I do have from mysterious places. You don't really have to worry. You'll see it in different ways in different books. But coming out of about here, it's not traditional lumbar thoraco-lumbar outflow, but somewhere around here, connected through the lumbar, through the sacral. It doesn't really matter. You have this outflow. What's really important is you get to the hypogastric plexus, and that's really what's important because that's an important prevertebral ganglia. And then from there, you can watch these postganglionic neurons. Where are they going? Going to the urinary bladder and going to the external genitals. And that's really what's important. And what's going to happen at these organs, at the urinary bladder, you're going to relax the urinary bladder. You're going to relax detrusor, which is the muscle that contracts. Forget about it. You don't want to urinate right now. You don't want to empty the bladder via contraction of detrusor. You want to chill out and relax. What do you do at the male external genitalia? Actually, it produces ejaculation. So the sympathetic arm actually produces ejaculation at the male external genitalia. And then not much really to speak of at the female external genitalia. You'll see more of that in terms of erection of the clitoris on the parasympathetic arm. That's driven by the parasympathetic arm. Okay? It's kind of an odd thing for ejaculation in the male external genitalia to be driven by the sympathetic arm. Not exactly running from a bear, but obviously sort of amped up, kind of full bore, energetic response, if you will. All right. And then H, two more. That's all we got. Two more. Remember, from all the lateral gray horns from T1 to L3, from all of them, you can continue this pathway that's H, and it was pathway number 3 from earlier, right? From all of these, you can do that little loop-to-loop, right, through the white ramus communicans, back through the gray ramus communicans, and you can feed the integumentary system at all the dermatomes. What are you feeding? Erector pili. You are innervating sudoriferous glands, and you're innervating the dermal blood vessels. And what's going to happen at those? Well, at erector pili, you're going to contract and cause erection of the hairs, the pili. Hairs standing on end, right? Sympathetic effect, like rushed and hair standing on end. You're going to constrict the dermal blood vessels. Why? You don't want blood in your integumentary system. You want to pull the blood deeper into your muscular system, right? So that you can just run and run and run away from that bear. And the dermal sudoriferous glands, you're just producing sweat like crazy, right? That's a classic symptom. You don't even have to be running away from a bear. You can get called on in class and not be paying attention, and your dermal sudoriferous, for one, your heart go to 150 beats a minute, and then 2, your dermal sudoriferous glands are just going to start cranking out sweat, and you're just pouring out sweat in that sympathetic response. And lastly, in a completely unique path, there is one path here that is not like the others, and I'd like you to look at it. I'm hoping you can find it on your own if you want to explore, but follow T, again, we're going to T10 and T11 because that's where all the excitement is really coming out on the lesser splanchnic nerve, which is highlighted here. You're running through this complex system and you're coming out, and I'm going to follow this preganglionic nerve. Notice in this whole area, there's only one solid line. There's only one preganglionic neuron, and it's coming all the way to what are called the chromaffin cells in the adrenal gland, which sits on the top, the superior aspect of the kidney. And then I want you to notice there is no synapse here. There is no post-ganglionic neuron right here, and that's for a reason. Because here you have entered the endocrine system. You are pinging these chromaffin cells, and the chromaffin cells, instead of running on an axon to an effector, these chromaffin cells are the effector. And you're smashing these chromaffin cells, and they are launching epinephrine, adrenaline, and norepinephrine, noradrenaline, launching it into your bloodstream. All right? And that, my friends, is epinephrine or pure adrenaline released into your bloodstream. And that is complete sympathetic fireworks, right? It's just boom. If you're an adrenaline junkie, this step right here, step I, that is what you live for. You live for the path that I just described as step I or pathway I. Adrenaline coursing through your veins, right? Fireworks, epinephrine, which is adrenaline by the same name, or noradrenaline or norepinephrine, just coursing through your vein and then causing all kinds of crazy effects down the road. But that is the be-all, end-all of sympathetic, amped-up response. Okay? And just to take a look anatomically, here is your spinal cord coming down. So this is going to be, I don't even know, come around T1. This might be T1. Hard to see in this view, but this might be about T1. T2, T3, T4, T5, T6, T7, T8, T9, T10, 11, 12. This might be L1, maybe right around here. But just so you can see that the sympathetic trunk ganglia are running right alongside, okay? And you're just going right to the sympathetic trunk ganglia if you're following the pathway, that sort of traditional pathway number 1, where you are going to synapse right here. If you are going to synapse there, which is the traditional pathway, then you're going to see that you're going to say that your preganglionic neuron is very short, right? Because it's just going from the spinal cord right to the sympathetic trunk ganglia that are running directly lateral to the spinal cord. So short pre, and then from there you're going to send out a long post-ganglionic neuron that's going to go to some sort of effector. So just a way for you to kind of play around with that in your mind. Okay, And we'll just finish it up because that's all I got for you. T1 to T5, okay? You're coming down, and what are you doing? You're on the same line, T1 to T5. You kind of want to get back up to the cervical level. So you're inferior to the cervical level, but you want to feed the superior cervical ganglion. You want to feed the middle cervical ganglion. You want to feed the inferior cervical ganglion that are all superior to you. So what do? You need a plan right here, okay? And what you're going to do is you're going to come right out and you're going to feed D. You're going to go right up to the superior. You're going to pass right through your trunk ganglion at your segmental level. Ignore it. Pass right through and go up to the superior, middle, and inferior cervical ganglia. Then on to the carotid, the cardiac, the pulmonary, and the esophageal plexuses, and then feed the eyes, the lacrimal glands, the salivary glands, the esophagus, the heart, and the bronchioles, and have your sympathetic effect on all of those. All right, T5 to T9, what are you going to do? B, you're going to feed right through the sympathetic trunk ganglion on your level, and you're going to go on to become the greater splanchnic nerve. And then you're going to feed that celiac ganglion. That's going to feed the liver, the gallbladder, the bile ducts, and the stomach and the pancreas, right? And at the liver, you're going to increase blood sugar. At the gallbladder, the bile duct, stomach, and all, you're going to essentially decrease digestion, right? And at the pancreas, you're going to crank up glucagon to increase blood sugar. So if you look at that, you see liver, gallbladder, bile duct, stomach, and pancreas. Think liver and pancreas increasing blood sugar. Think bile duct, stomach, and gallbladder decreasing digestion or digestive processes, if you will. All right, T11 to T12, T10 to T11. That's a big one. All right, and you're going to be the lesser splanchnic nerve in all cases. So I'm just kind of cheating and I'm telling you which three it is, okay? It's A, E, and F. So cat's out of the bag. It's A, E, and F, and let's just review briefly what each one of those is. All along the lesser splanchnic nerve. At A, you're feeding the superior mesenteric ganglion. That's feeding the small intestine and the colon to decrease mobility, and in the case of the intestine, decrease absorption of nutrients. Stop digesting. Run away from the bear, save your life, stop, catch your breath, go back to the parasympathetic arm and undo all these things we do, right? Do the opposite of all these. You'll see when we get to the parasympathetic, every effect that we do in the sympathetic is functionally the opposite when you're in the parasympathetic arm. E, right through the sympathetic trunk ganglion on your level, become the lesser splanchnic, feed the chromaffin cells directly, and then ba-boom, ba-ba-ba-ba-ba-ba-ba-ba, right? Just off it goes. Just releasing pure adrenaline out of the adrenal glands, the chromaffin cells, releasing pure adrenaline or epinephrine into your bloodstream, and kaboom, the ultimate sympathetic effect. Or F, right through the sympathetic trunk ganglion, again to become the lesser splanchnic nerve, then onto the aortico-renal ganglion, serving the renal parenchyma, and you're shutting down urine production at the renal parenchyma, the kidney. T12, you're headed right through, and you're going to become the least splanchnic nerve, C, right through the sympathetic trunk ganglion, making you a splanchnic nerve. In this case, you're going to be the least splanchnic nerve, and you're going to go on to the renal ganglion, and you're going to do a very similar thing that happens at the aorta, at the aortico-renal ganglion. Same thing, very similar thing. So you can think of the aortico-renal ganglion and the regular renal ganglion as pretty much doing the same thing. Go into the renal parenchyma and just shutting down urine production at the renal parenchyma. L, oh, I took off my ink. All right, sorry. I wanted to get rid of the ink that I've been hacking up on the right, but it's all right. You guys remember. Now, you know what? Let me do this right. Let me take 30 seconds to redo this. T1 to T5 was D. T5 to T9 was B. T10 to T11 were A, E, and F. And then T12 was going to be C. What's L1 to L3? What is the outflow from L1 to L3? The outflow from L1 to L3, I'm glad you asked, is going to become the lumbar splanchnic nerve, right through the sympathetic trunk ganglia. To become the lumbar, feed that inferior mesenteric ganglion that's going to go back, feed the colon and the rectum to decrease mobility. Stop pushing feces through the digestive tract. Not the right time. And then the sacral trunk ganglion, from some part of the sacral region, really what happens on the preganglionic side is really not that important. What's important is preganglionic neuron gets to the hypogastric plexus, and then from there, your post-ganglionic neurons can feed the urinary bladder to relax detrusor, and even to tighten the sphincter so you close up the urinary bladder so you don't urinate, as well as to going to the male external genitalia and creating, basically facilitating ejaculation at the male external genitalia. Okay. That's it. That's all I got for you on that. And then I will not go through this second test yourself. Use it for your own worksheet right here. The first two, the eyes, you're going to dilate your pupil so that you can bring in all the light in the world through the ciliaris muscle, and you're going to accommodate your lens for far vision so you can see forever. Eyes wide open, running for your life. You're just like a computer processing how you're going to run away from that bear. Lacrimal gland, decreased secretion. You don't need to be producing tears. Salivary gland, you don't need to be digesting, and on and on and on it goes. Just follow the video. These are all takes from the video at each one of these levels, and you can work your way through all that. All right? Long video. Sorry about that, but it is the sympathetic nervous system. It's super important. Parasympathetic is much simpler, and enteric is way simpler than that. So we're just going downhill in terms of difficulty, or more easy as we go on in the next two. All right, thanks for watching, and I really hope that that helps you to get your head around the sympathetic nervous system.